when I was about 10 or 12 years old. I wanted to be a veterinarian. And I worked for a veterinarian when I was 15, 16, and through high school, and then went to Auburn University for 7 years to become a veterinarian. Moved up here in 1980, opened up this clinic. Hello. Today we want to talk a little bit about vision problems and what can go on with the eye. Just like in people, dogs and cats have two eyes, and they can have serious problems through different parts of their lives. Probably the earliest problem we see is shampoo problems. You say shampoo problems? Yeah, I'm afraid shampoo. In fact, we saw one last week where the owner bathed the dog and unfortunately didn't use a tearless shampoo. If you're going to use an over-the-counter shampoo, be sure to use a tearless shampoo, because that way if it gets a little bit in the eye, it's not going to cause an ulcer. This little dog had an ulcer in its eye. We use a little process called fluorescein stain where we put a little green dye in the eye. It turns it a little spot green, and then we heal it up. If you've ever had a corneal ulcer, and that's what it was, you know how painful they can be. We put them on medication to reduce the soreness and also to control any infection. But tearless shampoos such as Johnson's baby shampoo, if you need to use an over-the-counter shampoo, it does a really good job. Rinse it off really, really good, because you don't want to leave spots of shampoo on the skin and cause a skin problem. So work on that. Try not to get the shampoo in the eyes. A lot of medications are safe, but especially if they have alcohol in them. Like say you're wiping the dog's ears out after it's been to the lake and got water in its ear and you're wiping it out with a little alcohol. Keep the alcohol away from the eye, because of course it will cause an ulcer too. And then you'll be back here, we'll be staining it and putting him on medication. So if you keep the alcohol away, the shampoos, a lot of stuff can really irritate dog or cat eyes, and they just don't understand what's going on. They'll go around the house squinting a lot like that. Yeah. And they'll be real, what we call photophobic, which means they hide out in the kitchen or dark areas of the house and try not to get in the light. As they get older, eye problems range from all sorts of different ones. The most common one is what we call lenticular sclerosis. Lenticular sclerosis is where the lens starts getting a little white film in the back part of the eye. If you look in the dog's eyes, people will say, oh, he's going blind, he's going blind. Well, the good news is most of the time they can still see certain amounts of things. It's sort of like the difference between looking out of a convertible back window, that plastic window. It starts out nice and crystal clear, and then over a period of years it turns sort of milky. And that's what's going on with these little eyes. If it gets to be a real problem, we can refer you to a veterinary ophthalmologist like at the University of Tennessee in Knoxville, and they can remove those if necessary. But most dogs do quite well their entire lives without that procedure. Another thing we see from time to time, it can be a real problem, people don't understand what's going on, are the little Pekingese and the little pug-faced dogs, and they end up, unfortunately, with all that hair and the skin right here on the edges of their nose. It pushes on their eyes, the hair gets in their eyes, and can be a real problem. It can set up infections and cause serious problems there. So if you have one of those little dogs, be sure to keep an eye on those areas right there. Keep them clean, keep the hair trimmed back so that the hair doesn't get in the eye and cause a problem. Other things we see are what's called, a big word coming up, keratoconjunctivitis sicca, or KCS. KCS is a deficiency of tears in the eye. And you may have seen a lot of commercials lately talking about people with dry eyes and people. And that's the same thing that's going on in dogs and cats, particularly dogs. They have a couple different tear glands, one above the eye, below the eye, and to the side, that produce tears. If for some reason one of those glands doesn't produce enough tears, the eye actually dries out a little bit. It doesn't get dry like a raisin, but it's not as wet as it should be. It's sort of like you running your car with only half the oil in it. It just doesn't work real well, and you don't want to push it. And what happens is you start getting a bunch of sleepers in the eye if their tears don't produce enough, if their eye glands don't produce enough tears. And that can be a real problem. Unfortunately, There's not a whole lot you can do surgically to fix that. There's a lot of different things you can do medically to treat it, such as artificial tears and even cyclosporine drops, things like that. And normally we can get a very good response on those, but it is considered a lifetime problem at that point if it's diagnosed. The only way to diagnose is a test we run in the veterinary hospitals called the Schirmer tear test, and if necessary, we can do that. Other things such as glaucoma, we see glaucoma more often and cockers and things like that. Glaucoma is defined as an increase in the amount of intraocular pressure, where the pressure in the dog's eye increases, just like glaucoma in people. We have a tonneau pen here where we can tap the eye, just pretty much like your ophthalmologist does, and we can measure the eye pressure in the dog or cat's eye. And then we can see if it's glaucoma developing. Unfortunately, the treatment for glaucoma can be complicated. There are some surgeries available, but a lot of times, unfortunately, the eye is not salvageable, and it can be a real serious problem. We do work with an ophthalmologist from the University of Tennessee on some of these more advanced cases. Other things that can happen would be what we call entropion. If you're looking at an eyelid and you pull it down and the eyelid rolls out and there's hairs on the inside, that's called entropion. That's where the eyelid rolls in, and it can be a lifetime problem. We see it more commonly in the Shar-Peis and Chows in particular. Ectropion, just as the opposite, it's where the eyelid rolls out, and sometimes we see those too, and that can be a real serious problem. But most of all, what we see are just simple conjunctivitis, dust, pollen, sprays. You have to be careful when you're cleaning your carpet at home. Don't use a lot of powdery stuff and then let the dog or cat run in, because that powder circulates the ground at the ground level. And your pet's running down there, so keep that under control. Conjunctivitis is simply just an inflammation of the white part around your dog or cat's eyes, and it can come from many problems. Lastly, in cats, there's a problem in young kittens called kitten sore eye, and it's associated with rhinotracheitis or calicivirus. You've probably seen it, and it's a problem. It can last anywhere from 4 weeks to 3 or 4 months, and it can be a real serious problem. So we recommend working on that. So from kittens and puppies to adult dogs with old dog eyes, such as cataracts or lenticular sclerosis, your dog or cat's eyes are precious to them and needs to be precious to you. So be sure to get a good routine physical and have those eyes checked.